legislature was able to pass a new state budget, finishing their work in the nick of time. In the coming weeks, we plan to bring you interviews with the Senate leaders of the various budget areas. And we begin today with the chair of Health and Human Services, Senator Michelle Benson. Thank you so much for joining me.
I'm glad to be here. Thank you for inviting me.
The Senate passed the Omnibus Health and Human Services bill on a vote of 62-4, so almost unanimous support. Your House counterpart, Representative Tina Liebling, called this the best HHS bill that we've seen in a generation. What's your perspective?
Well, I would say it was certainly the most expensive and the biggest. I know we're going to talk about federal funds, but about $1.2 billion in federal money, one-time federal money, was put into this Health and Human Services budget area. So there were some things that were my priorities, making sure we had a robust public health system, making sure that newborn screening included the Vivian Act carried by Senator Karin Housley to protect newborns from preventable deafness and other congenital and neonate problems, making sure that our Department of Health, as it comes out of the pandemic, is stable. At the Department of Human Services, making sure that our private healthcare market could be protected and robust, and we have a stable public program system with program integrity built in. And that's the part that I thought was missing the most, was some program integrity with all this spending, hoping that our existing integrity infrastructure really supported the increase in spending. But additional federal funds for home and community-based services, additional federal funds for mental health, additional federal funds for substance use disorder, additional federal funds for child care. It's very hard to spend $1.2 billion in 2.5 years and not create some ongoing spending. So there are some really good things as we recover from the pandemic, awareness that telehealth and child care stabilization are going to be important to get our economy going. But it was a great opportunity to restabilize after COVID.
So there's a lot to unpack in what you just said. And the first part is that influx of federal funds that you had. And I know it was important to your caucus to make sure that none of that money got stuck in the tails or was, was going to be spent in following years. So as you worked through that, what are some of the highlights of the one-time spending that you were able to do?
Right. Well, particularly in home and community-based services, we use some of that money for grants to help people convert their homes so they can stay there longer. There are nonprofits that will go into someone's home and widen doorways or put in ramps. We thought that was an important investment. As child care comes out of COVID and being partially shut down, they were given the opportunity to do some refurbishment and do some upgrades so that they can continue to attract more people and be ready for when people are fully engaged in the economy if they need childcare. So those are just a couple of highlights. Mental health investment, that was really important. One of the long-term side effects of not COVID, but our response to COVID is going to be the mental health impacts that this is having, the people who are feeling depressed and anxious. We have seen a considerable increase, particularly in pediatric and adolescent mental health crisis. We have full beds. We did put some pediatric mental health beds and some adult mental health beds into this bill. And I don't know that it will be enough, but it's an important start and a critical acknowledgement to those families who are suffering through mental health crisis. And we use some one-time money to help shore up our mental health system.
And you've expressed on several occasions your concern for the pediatric mental health in particular, but as a rule across the board, it is, perhaps we're more aware, or it is increasing. And so there's one-time money going to that. Is there also some ongoing spending to support that?
Part of the money went to increase support that will continue long-term, but we tried to have that take a jump and then stay flat so that we don't build in massive spending increases in that area. It will have to compete with education and everything else. We did put in some substance use grants and mental health grants into our school systems so that where the kids are, and if as they return, particularly this fall, they're in crisis, they will have some support and hopefully keep them out of a place where they need inpatient treatment or where they end up being hospitalized.
Now, you said on the floor of the Senate that lessons learned from the COVID-19 pandemic are reflected in this bill. What are the lessons learned and how are they reflected?
Well, telehealth, which I know has been a big topic of conversation, this fundamental change in the way that we engage with the healthcare system. It was going to take 4, 5, 6 years to get here, and we accelerated it and did it in about 3 months. So what's the good that came out of that? We know that for mental health supports and substance use supports in particular, sometimes just that check-in phone call keeps people out of crisis. There's a lot of screening that you can do at home, and we're going to talk about mother-baby health. The Mayo Clinic is working on monitoring moms and babies remotely so that you don't have to take an entire day off work just to get a check-in appointment. They can do a remote monitoring, and some of that accelerated through the pandemic. Also, our public health infrastructure bent, didn't break, they held together, but they were stressed, and our public health infrastructure learned some important lessons about being able to coordinate, not just with our Department of Health, but regionally and with their hospital systems. And so we made sure that they got some funding, stable funding, but also some innovation grants so that if they want to hire an epidemiologist or upgrade some of their local facilities in partnership with their hospitals, they're going to be able to do that. We don't anticipate that there's going to be a COVID-like health crisis, but being able to respond to a regional measles outbreak is going to be important, not having everything in St. Paul, but having the whole state be strong in their public health response. And those are a couple of examples.
According to the Maternal Health Task Force at the Harvard Chan School, the U.S. is at the bottom among developed nations in preventing pregnancy-related deaths. There are provisions in this bill intended to improve maternal and newborn welfare. What are they?
Well, we expanded medical assistance coverage for moms postpartum. It was 60 days. The Senate took a 6-month position, but the House and the governor prevailed, so 12 months of coverage so that as moms might be going through difficulties with breastfeeding, we know that that bond with moms and babies is really important for babies' well-being, so they get support longer. Maternal postpartum depression is a significant factor in particularly suicide postpartum. And so this way they would have access to mental health care beyond 60 days and hopefully through the whole postpartum cycle. But also the ability when you bring your baby in for a well baby check, for you as a mom to be checked, because not everything that could go wrong postpartum happens in those first 60 days. And so we're hoping that that is one provision. But we also made sure there was a robust investment in home visiting so that particularly moms who are at risk, you know, if you are a stable family and you don't need help, that's fine. But there are some families who find challenges and could use some support through home visiting. We also took a specific approach. There's a great deal of health disparity in our maternal morbidity. And so helping doulas and midwives understand that there might be cultural differences in the birth experience. I'm guessing you and I had pretty similar birth experiences, but people who come from other cultures might not want that birth experience. So how do we safely acknowledge those cultural differences, but bring moms and babies to a healthy, safe place?
Senator Michelle Benson, it's so good to see you in person, and thank you.
It's good to be here in person. Thanks for the invitation.